Hi, and welcome back to another webinar from Med School Coach. Today we're going to be talking about exploring medical specialties. This is going to be a very broad discussion. Again, I'm going to keep this relatively brief because I want to really focus on getting you some ideas to begin with. It's certainly not going to be comprehensive, and I don't expect you to leave this presentation knowing exactly what you want to do with your career, but hopefully stimulate some discussion, get you thinking about the right things. So let me introduce myself real quick. If you've been following along, you already know me. I'm Dr. Flick. I'm the director of the Residency Advising Division at Med School Coach. I also am the associate director of some pre-medical advising, and I am a reservist in the Army as a flight surgeon and family physician. And in my civilian life, I practice rural family medicine. So let's jump right into what exactly we're going to talk about. So I'll lay it all out for you, and then we'll get talking about the specifics. So we're going to start with talking about broad themes. So just get you an idea of at least starting the discussion about what you want to do in medicine. We're going to talk about the competitiveness of each specialty in broad strokes. And then we're going to talk about what the training actually looks like and how much money you're going to make. So let's jump right into it. Let's talk about some broad strokes here about roughly the ideas of what you should be thinking about when starting the discussion of thinking about what specialty you want to pursue. So let's start by talking a little bit about work-life balance. Some people argue this doesn't exist in medicine. I beg to differ. I think there's a great way to balance your life. This is not an exhaustive list by any means, but hopefully just getting you thinking about the things that you'll be balancing professionally versus at home. So let's take a look on the left side here with the work aspect. Some of the things that you might want to consider in terms of balancing work and life at the job site, you're going to have administrative stuff. So we're talking about paperwork, training, learning computer systems, stuff like that. It's part of every specialty from orthopedic surgery to pediatrics. And then patient care, okay? Most people are going to go on to practice some form of clinical medicine. A lot of that time is going to be spent with patients. And that involves seeing the patients, charting on the patients, and the mental efforts going into thinking about your patients. Just because you leave work doesn't mean you won't be thinking about some of the stuff you did during the day. So the amount of patients you're seeing, the types of patients you're going to see are going to kind of weigh on that whole aspect. Okay, and then academic interests. So that might be publications, presentations, conferences, and any research you might be doing. Now, there's plenty of other responsibilities at work, but these are just some ideas of the things that you're going to be looking at. Okay, let's talk about life. So you're going to be juggling things like the stuff you're interested in doing, your hobbies and activities, the people you spend time with, like your friends and your family, and then all sorts of other stuff on here too. Let's at least explore how that kind of plays out in different specialties. Some people have an idea that there's lifestyle specialties and there's kind of work specialties. Like some people will think of, okay, something like dermatology, which is largely outpatient based, not a lot of call involved, is somewhat of a lifestyle specialty, while things like a general surgeon may be tied to the hospital and doesn't have much of a life outside of that. On call, in the hospital, doing rounds, seeing patients in an outpatient scenario too. These are just kind of, you can think of them as stereotypes of specialties. So there's always exceptions to the rule. There's always caveats. So just because you're a general surgeon doesn't mean you don't enjoy life outside of the OR. Just because you're a dermatologist doesn't mean you're making tons of money and kicking back and relaxing all the time. So you'll find more about that as you start to rotate on these specialties and get experience in them. Start examining those specialties and ask, attendings, fellows, residents, what that work-life balance is, and start to think what you would really want out of your professional career in terms of balancing these things. Okay, let's talk about some more broad strokes. So pagers to me are a foreign object in family medicine. I work in an outpatient clinic, and the idea of a pager is a distant memory for me. For some people, it's part of something they clip onto their pants or their jacket every single day. That should go into your idea of being on call. So some people relish the idea of being able to rush in and take care of emergencies in the hospital or field phone calls. Being on call 24/7 or throughout the week or throughout the month. Some people, like me personally, I don't want anything to do with a pager, and so I'm kind of in my mind as a medical student thinking, hey, I'm not interested in being on call. I'm going to start looking into specialties where we don't take too much call. So call schedule, or just the ability to be on call or not on call, is something you want to at least consider. Think about what kind of practice environment you like to be in. On the left side, you see a nice country rural clinic there. On the right side, you see a major academic center. Which one of these is appealing to you in terms of a workplace environment? Interestingly enough, the image on the left of the rural type clinic is actually a clinic I'm affiliated with, and it's actually an old house. So think about the kind of environment you want to be in. Nice, cozy, quiet office, or bustling, busy, major medical center. And there's lots of stuff in between, right? So think about what you enjoy, what you don't like, and that will start kind of framing where you might look to practice. Do you prefer an operating room or a quiet exam room? And remember that specialties aren't confined to one or the other. For me personally, when I was a medical student, the OR always felt kind of foreign and a little bit intimidating to me. Lots of medical students start that way, but then sometimes come to enjoy that setting and find it comforting and find it invigorating. Or maybe do you like the idea of an outpatient clinic where you've got a nice quiet exam room, usually devoid of large emergencies, although that's not always the case. Think about large practice settings, like what kind of clinic you'd be in, and then what kind of scenario within that you might enjoy. In terms of specialties, think about maybe this idea of procedural versus cerebral. So now these again are stereotypes to specialties. And so, we want to think about these in broad terms, but for instance, some specialties are more procedure-based, like certainly surgical subspecialties and other surgical specialties, versus something like psychiatry or neurology, which is very cerebral and thinking-oriented, which is also not to say that surgeons aren't thinking, and that's not to say that other specialties like even psychiatry don't do procedures, which they do. So just think of these in broad strokes, knowing there's always caveats and exceptions to these rules, but these are general, broad, large sweeping terms that you should at least consider in directing where you're going with this. So hopefully that gives you an idea of just some broad things to think about in terms of choosing a specialty. Let's talk about how competitive specialties can be. This is not going to be exhaustive. I just want to present you with some ideas of what you're really getting yourself into. So let's start with something called fill ratios, which is basically how many, what number of applicants are out there per position, and how many positions are out there. I'm going to, as we go through some of these statistics, I want you to focus on, we're going to talk about pediatrics and dermatology, because I like how they compare and differentiate on some of these issues. We're going to be looking at the third column on your screen here, which is the number of all applicants per position. This is a ratio. So the closer that ratio is to 1 means that the closer there are 1 spot for every applicant. The farther you deviate upwards from that number, that means there's more applicants per spot, which makes it more competitive just based on how many people are out there and how many people are applying to those limited spots. So let's take a look at dermatology to begin with. And look at the numbers here. So you see 472 positions offered, 651 number of all applicants, with a ratio of 1.38. So that number, you can just at least look in that third column and see that 1.38 is relatively high. It's not the highest compared to other things. It's also not the lowest. So let's take a look at what those numbers mean though. 651 applicants, 472 positions. That actually equals out to something about 27% of applicants are not matching into the specialty. Despite the actual number being about 200 applicants, it's a relatively large percentage of that population applying. Now, let's compare that to pediatrics. Here we see a much larger number, right? There's 2,800 positions roughly, 3,000 applicants, and the ratio is about 1.07. Much closer to 1, which means there's more positions for the applicants, but still notice here, about 200 applicants aren't matching. Same amount of applicants that aren't matching in dermatology, but that's a relatively small percentage of the whole pool. That's only about 6%. So understanding how many people are applying in that specialty, how many spots are out there, gives you an idea just based on how competitive the specialty is in terms of who's applying there. There's lots of other factors to consider. Let's look at step 1. So quick caveat here is that in 2021, step 1 is going to pass fail, and the focus will shift over to step 2 CK. The numbers are basically the same comparing these stats you're looking at right here to step 2 CK. The numbers are just a little off, but they correspond basically to how competitive the specialty is. So let's again look at derm and pediatrics. So dermatology is the third from the left over there. You can see the average for the people that match is somewhere around 250. Compared to pediatrics, which is over on the right third of the screen, you see the average is somewhere in between 220 and 230. So these step 1 score and later on your step 2 CK score, these are going to be important in what specialties you can competitively apply to, which means if you're a young first year medical student, you should start thinking about how your standardized tests will play into your specialty choice. If you're later in the application process, maybe even applying this year to the match, just know how that's going to impact your ability to match. Let's look at some of the other things out here. Publications and posters represents on your ARIS application, abstracts, presentations, and publications. This is for US allopathic seniors. Again, let's look at dermatology and pediatrics. You see over there, dermatology has got an average of over 14 abstracts, presentations, and publications, which means they highly take into consideration your academic pursuits and research, versus pediatrics where there's only about 4 of these. So this should, again, if you're early in your medical application or your career, then you should be looking at, building up your research if you happen to want to go into things like dermatology, neurosurgery, plastic surgery, radiation oncology, which place a high emphasis on that. Conversely, if you're later in the application cycle and it's too late to kind of accrue these experiences, just know how this is going to factor in your application. Okay, so let's look at the overall percent matching. We talked about fill ratios, which is just an example of how many applicants are out there per spot. Now let's look at the overall percent matching for US allopathic seniors. You can see that, very notably that for most specialties, the match rate is in the high 80s and 90s, which is reassuring in the sense that lots and lots of US allopathic seniors match, whether it's going into dermatology or pediatrics. Here you see the derm match rate is about 81%, while the pediatrics is around 98%. Both are pretty good, but just understand too that the overall chance of matching is overall very good for allopathic seniors. Now, we're going to jump back and forth between a couple charts here, because I also want to show you for the other listeners out there for DOs, and then later we're going to look at IMGs too. So let's look at DO, and then we'll flip back and forth and look at how these compare here. So look at here for dermatology over there, third from the left. All of a sudden, we dropped back from here's the US allopathic senior match rate, about 81%, all the way down to about 38% for DO students. Now let's flip back here and look at pediatrics again, 98.8% chance of matching for allopathic. For osteopathic, pediatrics is about 88. So depending on if you're a DO or an MD, you need to understand that statistically speaking, your chances of matching into these specialties is highly dependent on your terminal degree here. So just something to keep in mind. Okay, quick flip over to IMGs. The overall topic I want you to understand is that if you're choosing a specialty, no matter if it's dermatology or pediatrics, all IMGs tend to do poorly in the match. You look at the overall numbers here around the 50s, 60s, the highest they go up to is a 70% match rate, which actually happens to be for pediatrics. In general, if you're an IMG, you just have to know that you're going to have a hurdle to climb here, is that a lot of IMG applicants just don't match, which means you have to choose your specialty wisely. Take a look, let's look at something different besides derm and pediatrics here. Let's look at something that has a low match rate. Let's look all the way over to the right, third from the right, which is plastic surgery. Only 33% of US IMGs match into plastic surgery. So if you're thinking about some of these more competitive specialties and you're an IMG, just know that you're already set up for a little bit of a disadvantage coming into it. Okay, enough of statistics and graphs. Let's talk a little bit about the training for specialty, which will help you get an idea of maybe what you're interested in and the, I don't want to say repercussions, but the implications of your training time. Let's look at length of the residency. So here's a spread. You can find your residency of choice on here, all the way from the 3-year plan for pediatrics, family medicine, and internal medicine, all the way to neurosurgery, which is a 7-year training program. How does the length of a residency play into your decision to choose that specialty? Well, here's a couple of things to consider. Here's some things. Number one, residency is not necessarily a pleasant time. You're going to be working far more than you want to, long hours, long days. It's a challenging time. Do you want to spend 3 years, 4 years, 5 years, 6 years, 7 years in this challenging portion of your life? Are you willing to go through some of that, the trials and tribulations of residency? Or do you want to, move on to the attending life? Another thing to consider is finances, which we're going to jump into in a second. Many applicants out there have undergraduate debt, medical school debt, and they're deferring that while they're still studying. As you go on to residency, you're not making a terribly large sum of money during this time period, anywhere from $40,000, $50,000, $60,000, $70,000 a year. That's a lot of time to be making a relatively small amount of money for a physician and then also having lots of debt to pay back. The longer you're in your residency, the less chance you have to pay back your loans. And some people will go on to defer their loans through residency, which is a whole nother topic. So just take a look at this in terms of gearing, hey, how much time do I want to spend in my training? Consider too that also there's specialties not listed on here, some fellowship positions like gastroenterology, cardiology are going to be fellowships after your 3-year plan in internal medicine. Okay, now the last thing we're going to talk about here is money. Sometimes money in medicine can be somewhat taboo or something people don't want to talk about, but it is still something to be considered. Nobody really goes into medicine, or hopefully you didn't get into medicine to make money, but you need to consider it when you're choosing your career. So here's a physician compensation chart that basically breaks it down from the top earners to the lowest earners. Plastic surgeons rounding out the top at about $500,000 a year, and then the public health folks at the bottom making $200,000 a year. $200,000 a year is nothing to sneeze at, and especially if you're a medical student in debt, or if you're a resident making $50,000 a year, $200,000 sounds great. This is just something to keep in mind in terms of what kind of lifestyle you're going to be pursuing, locations that you might be looking to live in. These numbers are going to vary widely per position, job, region, all across the board. So just because you go into plastics doesn't mean you're going to make 500,000. Just because you're going into pediatrics doesn't mean you're going to make 200,000. So there is a large fluctuation here in the actual numbers that you'll come out with. But it's at least good to consider how much money, or at least know how much money you might be making in each specialty. Again, I would caution against making maybe any life decision based on money alone, but you may or may not choose a specialty just based on how much money you're going to make. But it's good to know what you're getting yourself into to set healthy expectations. Well, there you have it, a couple of different ways to think about exploring what kind of specialty you're interested in. I hope you found this helpful. We'll open it up to some questions so we can talk about what you're interested in, maybe questions you have about length of residency training, what residency is like, and any questions you may have about getting to the process of actually choosing your medical specialty. Thanks again for joining us. We'll open up to questions right now. Thank you.
Thank you, Dr. Flick. We have some great questions that came in, so we can get started. The first one, when should I have made my decision and about which specialty I want to pursue?
Sure. I mean, ultimately, you have to make your decision by the time that you're applying for the match, which is typically as you begin your 4th year of medical school. But that's really the only deadline that you have. And so some people feel a little bit pressured, like, they get into medical school, they're talking to their peers in their 1st year, and everybody else knows what they want to do, but you don't. There's really no reason why in 1st year or 2nd year you need to make a decision. Now, if you already have an inkling into what you might want to do, especially if that's a more competitive field that requires research, then you might want to at least pursue some of that research in your 1st and 2nd year to boost your resume. But there's no reason that you have to decide that early. And really, it's difficult to make that decision until you've done your clinical rotations in that specialty. So the absolute deadline is, before the match occurs in your 4th year, which is basically, 4 or 5 months before you graduate. But you should probably make up that decision about halfway through your 3rd year once you've rotated through a core block of specialties.
Okay, talking about specialties, we have a question. How about geriatrics as a specialty? Is it good for finding a match?
That's a good question. Geriatrics is typically a fellowship that's a subspecialty off internal medicine or family medicine. Nowadays, most internists treat older patients compared to family medicine physicians. So, if your interest was treating people over the age of 65, let's say, that would be easily accomplished with just a general internal medicine residency. You could go on to do a fellowship. There's a lot of nuances and complexities to treating older patients. And so that fellowship would be a 1 or 2 year add on after a 3-year residency with family medicine or internal medicine.
Okay, and then another one. Is there anything IMGs can do to increase their chances for something like emergency medicine?
Yeah, or basically, I think that the heart of the question is how to be more competitive as an international medical graduate. It's basically checking all the blocks that the NRMP is looking for, the match process is looking for. So you're going to need to have good scores. That means on your board scores and in your clinical rotations in your first and second year of medical school. You're going to have to boost your resume, which means you're probably going to want to have research. If you can, it should be targeted in emergency medicine. You're going to want to have some extracurricular experiences, some leadership experiences, some community service. So everything that everybody else has to have, just more of it. You're definitely going to have to do better on your board scores. As we saw, IMGs always have higher board scores because the field is much more competitive. So whether it's ER or any other specialty, you just need to do more of everything else that's out there. Additionally, I think it's important to really pay very close attention to how your application is constructed. Knowing, or at least getting an idea of what program directors think about international medical graduates helps you construct an application that specifically assuages some of those fears, makes program directors more comfortable about IMGs in general.
Okay, and we have a student. I'm interested in neurology, such as treating Parkinson's, Huntington, etc. How should I focus my studies?
Cool. So focusing your studies, whether you're a first or second year medical student, you'll probably want to get in with your medical school and start shadowing or spending time with a neurologist just so you can get more experience with the field. You're definitely going to want to do some research, whether it's with your own institution or reaching out to neighboring institutions to do some research specifically targeted towards neurology. You're going to want to pay very close attention to what those NRMP statistics are for neurology. Make sure that at the very minimum, you meet that average USMLE Step 1, Step 2 score. And then when it comes time to apply, you're going to want to craft a very specific personal statement that shows the reader, the program directors, why you're a good fit for neurology.
Thank you. How is it determined how many hours doctors work? Do they get paid a flat salary?
Sure, back to salaries. Some people work an hourly rate. So if you work in, say, like an urgent care, you may get paid just an hourly rate. Most physicians are getting just paid a salary, and the hours that you work are very dependent on your specialty. So normal for family medicine is anywhere from 32 to 40 hours a week. That may differ for an orthopedic surgeon, but strictly speaking, you're looking at roughly about 40 hours a week at a bare minimum. For the surgical subspecialties, I mean, you're also going to be on call. And so that may weigh into exactly how many real hours you're putting in based on how many hours are on your contract.
Okay. And what happens if I get into a specialty and then change my mind?
Yeah, that happens, right? And I've actually worked with many applicants that are reapplying to the match after already been through some specialties before. So let's say you're a resident. Let's say you do like 1 or 2 years of your residency and you're like, I don't like this. I don't want to do it anymore. You can go ahead and just reapply for the match. The match isn't just for medical students straight out of medical school. You can do it as a resident and as a fellow and attending wherever you want. You can reapply through the match. So I would at least try to get past intern year. I mean, nobody really likes intern year, whether you're doing something that you know you wanted to do or you're kind of a shot in the dark. So I would try to get through intern year, see what the second, third year of your residency is like. If you absolutely don't love it, you can reapply. The one thing I would caution you about is that in the US, having an MD degree doesn't necessarily mean you can get a job. And that's because most employers are looking for board certified physicians, which means you've completed your whole residency and you've taken a specific board certification test. So be cautious, because if you change fields, and especially you're shooting to match into something much more competitive and you fall through, then you're left with 1 or 2 years of a residency, no board certification, and a very difficult time trying to find a job.
On specialties, so urban versus suburban, big urban hospitals might be competitive, but how competitive?
Yeah, that's a bit of a subjective question, but the question's on the mark is that the closer you are to a major academic institution, so let's pick like, I'm on the West Coast, let's think like UCSF, University of California, San Francisco, huge academic center, big hub for research. Any program that's affiliated with that hospital, whether it's plastics or pediatrics, is going to be more competitive by nature. It's a higher tier of institution. That doesn't necessarily mean that your education will be better or less, or your job will be better or less. But it does mean that these are more competitive places to find residencies, find jobs. So how much more competitive, that's a difficult question to answer. But I would say for the most part, it's just going to be naturally easier to find work in a less populated area, just because there's a smaller population or pool of applicants.
So looking at specialties, what would be the easiest specialty to get into or the hardest specialty to get into?
Yeah, so some of that is based on, numbers, right? And at least for right now, the USMLE Step 1 is a big predictive value of how competitive the specialty is going to be. And so you can strictly look at just maybe, the Step 1 score as who's most competitive. So we're looking at plastic surgery, dermatology, interventional radiology, stuff like that. These things change every year, right? So for instance, psychiatry is becoming more competitive year by year. Emergency medicine is becoming much more competitive. So I would advise people too, if they're kind of really looking into how competitive my specialty is, don't just look at the NRMP data from this year, but look at it over the past 2 to 3 years. And that will kind of show you the emerging trend in that specialty. But at least for right now, we're looking at things like, interventional radiology, plastic surgery, that have these very high fill ratios where there's tons of applicants for very few spots.
And do you think that there's a big difference between the Northeast versus the Southeast if you're looking to get into a specialty in one of those areas? Would one area be easier or better?
Yeah, that's dependent on basically the setting. So kind of like we talked about urban, suburban, rural areas. So if you're looking at I think it's probably fair to take 2 large cities like New York City and Los Angeles and say, okay, major academic institutions like, NYU versus UCLA are going to be similar in their competitive nature. And then if you looked outside in the rural areas, or at least outside of the city, those would be comparable. But strictly comparing like, a community hospital in outside of Los Angeles to a community hospital outside New York City, it's just too subjective. When it comes to actually applying to residencies, there's a free resource through the AAMC called Residency Explorer, where you can actually look at the competitive nature of each individual program based on, USMLE scores, research, all that stuff. That's a great resource to get very nuanced data on comparing program to program, much more than I can say just in more vague terms.
Thank you. And it looks like one more question. What about new med schools, graduates of new medical schools without a Step 1? Are those schools considered competitive for graduates coming from?
So you're assuming that it's a new medical school that doesn't have so the applicant doesn't have a USMLE Step 1 score?
Correct.
Yeah, that's going to depend on, so I guess if you're a new medical student applying this cycle with no USMLE score, I don't have a good answer for that. Now, come 2021, and after that, everybody's going to have pass, fail. Most medical schools are going to be having you take Step 1, so I'm not really familiar with any, at least US-based medical schools that wouldn't be having you take Step 1. And that's a question that really goes into, well, what is Step 1? Why is it there? And it's more than just a test and a measure for, success in residency. Is that in order to be a licensed physician in the US, this is the US licensing exam. So you have to pass all of these. So I don't really know of any medical schools that wouldn't be taking these exams unless it's a DO school that's using COMLEX instead.
Got it. Thank you. I think we'll take one more minute to see if any other questions come in. And thank you, Dr. Flick, for your presentation tonight and for going throughout this series, the Med School Success Series.
Yeah, you're welcome.
I think that we don't have any more questions coming in. So thank you all for joining tonight. And I will be sending out the recording for this session along with the final series survey tomorrow. So be looking for that, and have a great night.
Thank you very much. Take care. Bye.